So you get to see patients, you work in a facility where they pretty much send the patients to you for education with nutrition. Are you just one-sided and you only look at nutrition, or do you also help with physical activity aspects?
Yeah, I actually work in a research setting and do a lot more around population health type programs. But I think when I've worked with people with diabetes, I think you want to look at the whole picture. So you need to think about all of their health risks. You want to think about their personal goals. I think sometimes in terms of living longer, healthier lives, what's personally going to keep them motivated to manage their health, and what are the factors like how much social support do they have, what's their living situation, do they have access to healthy foods. So you really want to look at the whole picture and try to help that individual develop a plan that's best for them, because the challenge is we only see patients an hour here or there throughout the year, right? And the rest of the time they're on their own. So how can you help them build the best support to be successful?
How many times are you allowed to see a diabetic patient?
I think typically, like if you're implementing medical nutrition therapy, and some of that probably varies by state and how their insurance is covered, but you recommend that people have at least 3 or 4 encounters with a registered dietitian, that they get some, you want to follow up with them to help them continue to tailor their eating pattern and look at their blood glucose levels, how they're, along with their food intake and their activity levels, and really continue to provide them information and support. You want to monitor how the success of what you've implemented with them and keep tailoring it to that person.